If you're anything like me, like learning anatomy through sports injuries, this is episode 68, and this is André Gomez, November 3rd, 2019. Andre, at the time, was playing for Everton. This is versus Tottenham Spurs. This guy's name is Son, and he's going to slide tackle from behind. And Andre is going to get tackled by another defender as well. And in this frame here, you see his bright yellow cleat is horizontal, and that's not supposed to happen. That's not good if you're Andre Gomez. They don't show the full replay here, but they do have frame by frame pictures that we're going to talk about. So, Son tackles from behind. Obviously, most soccer football fans would know that this is going to be a foul. So then Andre, at this point, is going to get tackled by this guy as well as his foot is planted and he's already going down. Now, I believe this defender's foot, forgive me, I don't know his name, lands on Andre's cleat, okay, his right cleat. And as he goes down, his foot is backwards in this picture, okay? It is overly internally rotated towards the midline of his body, towards his left leg. All right, and he's already going down, and this foot is backwards. And in the next frame, you can see it kind of rebounds and goes back externally rotated outwards, and he's already in pain. And then lastly, a horizontal cleat here. That's not good if you're Andre Gomez. So what happened? Well, it's an ankle injury, a fracture and dislocation of the talocrural joint. Okay, the talocrural joint is what makes up the ankle, is the anatomical name of the ankle. It is the tibia sitting on top of the talus. Okay, the tibia is your shin bone. On top of the talus is the bone above your heel bone. Okay, your heel bone is called your calcaneus, but the ankle is made up of the tibia and the talus. All right. So in an injury like this with an externally rotated ankle, medial structures on the inside of your ankle are going to be stretched and possibly damaged. So the medial structures would be the deltoid ligament, posterior tibial tendon, flexor digitorum longus, flexor hallucis longus, tibial nerve, posterior tibial artery. It's a mouthful there, but these are very important structures that we must be aware of in an injury like this. There's actually a photo here. I didn't blow this up because it's kind of graphic. You can see the tibial condyles here that would normally sit on top of the talus, but obviously are trying to poke out of his skin here. So what did they do? Well, an on-field stabilization was done where they stretchered him off of the field and they transported him to the hospital. Now, the swelling was likely so bad that they had to wait a day to do a surgery, and that's what they did, where they did an internal fixation. Rehab, it turned out to be a miraculous miracle, less than 3 months, 112 days to be exact, where he did 2 to 3 therapy sessions per day, consisting of aquatic therapy, progressive bone loading, plyometrics, as you can see in this photo, he's doing some plyo, joint mobilization, and up to 2 hours on stationary bikes for 1 to 2 sessions a day. All right, and he returned less than 4 months later, as we said, February 23rd of 2020. But now he plays in Ligue 1 on a team called Lille. That is my attempt at that. Please flame me in the comments. But that is André Gomez.